Botox. Sounds scary, something only celebrities get done, but you'd be surprised. Your spouse may be doing it and you'd never know. Botox is essentially a trade name for a substance called onabotulinum toxin A. Now, this is a substance derived from a fungus. It helps relax your muscles, any overactive muscles. So the muscles under the surface of your skin sometimes are a little overactive, a little tense, and just a little bit of Botox injected into these muscles relaxes those muscles and relaxes the overlying skin, smoothing out any wrinkles on the surface of your skin. Now, it's a very big myth that Botox is only done when you're super old and it's only for people who've really aged and full of wrinkles. But that's not true. A good time to do Botox is any time post the age of 18 when you feel your dynamic wrinkles are very prominent. Now, what are dynamic wrinkles? Dynamic wrinkles are those lines that only appear when you smile or when you frown. For example, when I smile, if you see these lines here, my crow's feet are getting prominent every time I smile. Over time, over the years, as you keep smiling, as you keep expressing, and these lines keep forming again and again, over time they're going to get static. Once they get static, that is, they're seen even at rest when you're not smiling. When they become static, Botox too is not frankly going to help. So the best time to do Botox is when these lines are still dynamic and they haven't formed static lines yet. So this could be in your 20s, it could be in your 30s, it could be in your 60s. But that is when you need to get your Botox done. So Botox can be used to treat wrinkles literally on any of your facial muscles. For example, if you have very prominent forehead lines when you raise your eyebrows, making you look very surprised all the time. Or if you have these prominent frown lines which make you look angry. Or if you have very prominent crow's feet here. Or a very prominent jawline or very square jaw and you want to make your face look slimmer. If you have bunny's lines here, which I personally think look rather cute, but a lot of people don't like those. Or if you have a very gummy smile, every time you smile, your gums are very, very prominently seen. Or if you have a popply chin, which is you get a lot of dimpling on your chin. All of these things can be treated beautifully with Botox. Other than facial aesthetics, we also use Botox to treat a whole lot of other medical conditions. For example, excess sweating on your palms and soles or your underarms. You can use it to treat migraines. You can use it to treat muscle spasms, torticollis, squint, so many indications for which you can use Botox. Now, what you can expect from the procedure is before we start the procedure, we numb your skin in that area so the procedure becomes virtually painless. We numb it using just a numbing cream which we apply for about half an hour to 1 hour. Post numbing, we sterilize the skin so we reduce the chances of infections. Once we've done that, then we map the wrinkles on your face. We assess which side the wrinkles are more prominent, which side they're less prominent, and we assess the individual asymmetries on your face. We then mark these areas out and we plan how we're going to inject your Botox, and then we inject it using a very fine needle of a very fine syringe. So it's really virtually painless. It just feels like an ant biting your skin. Once the Botox has been injected, you just have to take some care not to lie down for about 3 to 4 hours. Don't lift very heavy weights. Avoid green tea, avoid aspirin, and you'll see the results in about a week's time. You may first start to just see a little bit of heaviness seeping in, and then you'll finally see the entire results in a week's time where you've gotten rid of your wrinkles while keeping your look quite natural and quite minimal. A lot of patients have this misconception that once you do it, you have to keep doing it again and again. But this also is not true. Once you do your Botox and once it fades after a period of about 4 to 6 months, it's gone. It is eliminated from your body and it leaves no residual effect at all. You go back to your baseline level of wrinkling. Your muscles are going to just become active again, the muscles which were relaxed before, and you're going to go back to your baseline. So if you want to do a Botox again, absolutely you can. You probably want to because you got used to that wrinkle-free skin. But if you don't want to, you don't have to. A lot of people just do Botox before their wedding so that their makeup doesn't crease and they look a little fresher. But that's about it. They never do it again. So that's entirely up to you. The next question that you actually should ask is about the side effects. Side effects do happen even with Botox. There could be a little bit of asymmetry, there could be a little bit of drooping sometimes, very rarely. But let me tell you one thing here, that these side effects usually happen when the injector doesn't know what they're doing, when they don't understand the facial anatomy well enough. So make sure you go to a trained, qualified dermatologist who is experienced in doing these procedures. That is extremely important. Look at their degrees, look at their name, their reputation, and ask for word of mouth references. If your friends have been to them, that works brilliantly. So do choose your doctor wisely. If you have any more doubts about this procedure, do feel free to ask us in the comments below. If you want to get your Botox done, do visit us at Derma MD Clinics.